Thank you, Chairman Dreyer, members of the committee. Let me begin with the summary. The health care reform is already providing secure coverage to many Americans, giving families and small businesses more control over their health care, and already improving Medicare for seniors. The health reform is fully paid for and will lower the deficit by more than $100 billion in the first 10 years and more than 10 times that in the following decade as it's fully in effect. Now, I'm here to speak on behalf of several amendments before you, number 2, number 1, number 7, number 3, number 8, also Mr. Tierney's. And let me underscore something that may have been lost to you as he used the term medical loss ratio over and over again. Medical loss ratio is what an insurance company, unbelievably, that an insurance company says is lost revenue. Loss ratio is the fraction of their premiums that must be spent on medical care. Medical loss ratio. Yes, indeed, we should make sure that those requirements are not lost should there be a repeal of this law. More than 100,000 New Jersey residents in the Medicare donut hole have already received additional assistance in paying for their medications. Some of those medications life-saving. I've heard from many individuals in my district, individuals on fixed income, making difficult decisions between being able to afford their life-saving prescription drugs and their light bill and other expenses. Closing the donut hole will allow people like Howard from Monroe Township in my district to be able to afford his prescriptions. If he does not get them, he might lose his battle, as would others with their illnesses. Health reform ends the discrimination of individuals with pre-existing conditions. Many of the constituents in my district who do not have health insurance because of pre-existing condition are in tough shape. One of those, Todd, wrote to me, he said, quote, "I broke my back, rupturing 2 discs 2 years ago." He then went on to explain that he had, but lost coverage. He continued, quote, "I need 1 more surgery to get back to work. Unfortunately, no insurance company will touch me because of my pre-existing condition. I just want to get back to being a productive member of society," end quote. If health reform is repealed, Todd will not be eligible for insurance and will not be able to return to work. Another benefit from the health reform is the ability to add dependents, as we've heard, until age 26 to their parents' plans. Thousands of young adults in New Jersey have received health insurance through this. One is Anna's son. Anna from Kendall Park has a 24-year-old son who's attending nursing school. Health reform gives Anna a way to provide health insurance for her son, who is working to do just what we would want him to do. If health reform were to be repealed, seniors and people with disabilities would lose free wellness visits and preventive care, including cancer screening. Tax credits for small businesses would be lost, and the elimination of the limits on lifetime and annual expenses by the insurance company, that protection would be lost. Instead of having this discussion on repealing health care, we should be focusing on how to improve the health reform law through addition, for example, of Ms. Woolsey's public option. Just as, and I really want to emphasize this, with every major law in the past century, Congress will continue to revisit the health care reform law and to adjust it to changing conditions and to improve it over the years to come. Repeal now would only benefit insurance companies, not taxpayers. The existing law benefits taxpayers. It's not, as has been presented to us and as was campaigned and so forth, a repeal and replace. No, that's false billing. There is nothing in the bill before you, committee members, that has replacement language. The attempt to repeal the health reform law is similar to attempts that were made in the past to repeal Social Security and Medicare. Now, Medicare is widely seen as a successful program for helping Americans access health care. But it was very controversial when it was passed. The same arguments that we hear today were made then. Some leaders from Bob Dole to Gerald Ford fought the program and voted against its creation and sought its repeal. Medicare has virtually eliminated uninsurance among older Americans, and today only a fraction, a tiny fraction, of those age 65 and older lack health insurance. More than 40 years ago, Congress and the President were right to enact Medicare. I predict that in the future, today's uninformed cries of socialized medicine and today's political chatter and imagined burdens will have faded. Instead, it will be noted that we did the right thing by finally ensuring that all Americans have health care security and good, affordable health care, a goal that had eluded this nation for a century.
Thank you very much, Mr. Holt. Ms. Davis.
Thank you, Mr. Chairman.